Hi, this is Dr. Bennett. I'm with Dr. Park. Today we're going to be talking about building resilience with healing justice. By the end of the session, we hope that you're able to identify strategies to reduce harm and promote healing within your own practice, and understand how the concept of healing justice can enhance our capacity to build resilience in our patients, in ourselves, and in our communities. Let's start by establishing a shared definition of resilience. Resilience simply means a good outcome despite adversity. Oftentimes, when we talk about resilience, we talk about individual behaviors that someone can do to make themselves more resilient. I want to move away from this because when we're talking about a population who already has so much on their plate, giving them one more thing to do might be overwhelming, unless we take something off of their plate. In addition, it gives the appearance that we are blaming them, right? Well, if you would only do this, you would have a different outcome. But we have to remember that everyone's choices are limited by the options available. So when we discuss resilience today, I want to move beyond the individual. Move beyond individual behavior and think of the determinants that need to be available within the family, within the neighborhood, within the community, within your organization to promote resilience in our patients and in our healers. Our goal with this presentation is to introduce you to the concept of healing justice so we can engage in transformative changes. Take a few minutes to look at the characteristics in each category. Where does your organization fit in?
We'll start off by talking about the ways in which we can expand definitions of harm and healing beyond just the individual patient provider encounter. First, I'd like to talk about harm through this broader lens of structures and systems. How, despite your best intentions, your presence and your role as physicians, as providers, might accidentally hurt your patients more than you intended to. This is not in any way an indictment of individual providers, but rather an invitation for people to think about ways they can improve their own practices and prevent things like re-traumatization and extending harmful patterns that exist in broader society.
As you complete your list, look over it. Are the factors that you listed harmful to patients, providers, or communities? Or are they harmful all across the board?
When we think about trauma, it's in the context of like adverse childhood events and things that happen to our patients. And we as providers are brought in to kind of like mitigate that harm or support their resilience. But I don't think we talk often enough about the ways that our role as providers and the space that we are delivering our care can actually be a form of trauma and harm in themselves. I don't want people to feel like they are being, blamed or accused of abusing patients. That's not at all what this framework is about. It's about acknowledging how systems of oppression and inequitable power dynamics follow people into that patient provider relationship, that it's not something that is automatically left at the door and you're left with this perfectly equal and just like encounter in a complete vacuum. One way that I think we don't think about that trauma and harm can manifest in a medical setting are places where patients have a lack of control and choice and agency. So medicine, I think we all recognize, can be extremely paternalistic. And, it's been like that for a very long time. And it's the way that we are trained and brought up. And I want people to think about ways that that can actually be really damaging to patients who've had their choices and their agency taken away from them. And how being in a setting like a medical setting can have them relive those experiences. In addition, structures like racism and white supremacy, and the trauma of incarceration, the issues of economic injustice, environmental justice don't disappear as soon as people walk into the clinic. I think we talk about it in terms of like social determinants of health. I think there's like other ways we can bring that in and make sure that it's not just like our patients coming in with these quote unquote social determinants of health that impact their health, but how is our role and our presence like feeding into those harmful dynamics? What are ways that we are complicit and also responsible for like ameliorating some of those effects of social determinants? One way that we can resist that kind of like damage that can be done inadvertently by providers is by examining ways that we can prevent re-traumatization. There are things that are done in a systemic fashion and things that are done within that individual relationship. Even though we are trained to think like systematically and asked to do a thorough review of systems like thorough history taking, do a thorough physical exam, and we see that as something that is like necessary and beneficial for healing. In the process, we can sometimes end up hurting people. So one way, for example, that is highlighted in this slide is that even though we are taught to ask people about various private aspects of their health, it might bring up more for some people than others, and having to constantly revisit those narratives and present themselves like within the lens of past harm and past trauma can be profoundly disempowering for patients. When we ask people about their sexual histories, even going into that can be really stressful for some people. Being labeled a certain way, having diagnoses that are attached to them, and not really having an option in who they can even seek care from. These are all ways that the system can re traumatize people. I think when people think about psychiatry, and ways that we might traumatize patients, people automatically jump to things like restraints or IMs or injections and things like that. But sometimes it's the subtle things like information control, not knowing what other people know about you, what is documented in the chart versus what is being told to you. And for people who've been gaslit, who've been manipulated by like larger structures of authority, it can be like really scary. And ultimately, even beyond the trauma of that moment, those experiences can bleed out into like their future encounters with providers, and possibly prevent them from accessing care in the future. Which, for me as a psychiatrist, I often have to do a good history of a person's trauma and sexual, physical, emotional abuses, and I always try to preface that with a choice that this is we're going to be going into something more personal, and that is it okay if we talk about some things that might bring up bad memories. And I also ask them to like remind me when I am crossing some kind of boundary because I don't know exactly what's going on with them. And in general, like in the relationship between patients and their providers, like acknowledging the vulnerability within that encounter, and like constantly reminding patients that they actually do have choices in that encounter, and that like they have power over what is being done to them and to their bodies. For people who do physical exams, even if it's a child, it's not only important to like ask them if you can disrobe or like examine certain parts of their body, but it's not only useful for that encounter, but it can be useful for the future where you model for them like healthier boundaries and model for them what like a good consent system might look like. And always, again, reminding and inviting your patients to be an active participant in that process, even asking them, what level of disclosure are you comfortable with? These are all ways that I think may take extra time initially, but will eventually lead to like much healthier practices.
Because we all have so many different experiences and background and perceptions, it's not always easy to identify when we cause harm. So, one way to frame a conversation and try to create a safe space for your patients is by saying, "It's my job to get you. You shouldn't have to work to get me. If I miss something important or say something that doesn't feel right, please know you can tell me immediately and I will thank you for it." Healing is an ongoing process of mending, building power, resilience, and resistance to transform systems of oppression. I really love this definition because it points out the ongoing nature of this process. It never ends. We are always going to have to reevaluate and adjust based on the situation and the needs of the patient and the needs of ourselves. It also moves beyond just fixing what's broken, right? Mending is a part of healing, but we also have to look at the structures and the traits of the environment and the individual and ourselves that both cause harm and get in the way of healing. So this moves us beyond a deficit-based model to a strengths-based model. To introduce the concept of healing justice, I'm going to play a clip from the person who defined the term, Kara Page. As you watch the clip, try to imagine what steps we would need to take to fully implement healing justice in our work.
I feel like when I heard those two words, healing justice, not only did I not know exactly what it meant, but it hit a chord inside of me where I was like, oh, this is what I've been waiting to explore inside of movement spaces.
It really is the understanding that we need to intervene on generational, individual, and collective trauma from systemic violence, oppression, policing, and violence in all of our lives by recovering and intervening on the violence by actually centering our psychic, emotional, physical, spiritual, and environmental well-being for our collective liberation. For myself as a Black feminist that sees the South in this country as a political home, I was noticing and witnessing immense fascist, we could say, regressive policies attacking Black and brown bodies. And I started to invite conversation and really interviews with civil rights leaders from the 60s and 70s, because I said, I'm seeing burnout and an experience of trauma at such a level. And I'm curious, how did we hold the grief of the civil rights movement?
As someone who's experienced burnout, I think part of what happens is, as an organizer, especially as a Black woman organizer, people just think it's, quote, natural for us to do the work that we do, that we are exceptional, and that this is just what we do, and that there's no care that's needed for us. There's no care that's given to us in real and thoughtful ways. As organizers, we're taught that you learn a theory, but you don't just learn it so you can sit in your home and read about it and talk about it. You learn the theory so you can put it into practice, so you can go and change the material conditions for your community. Healing justice is just that.
We needed to understand that our work was rooted in place to respond to particular conditions. Look at the injustices that are showing up that are impacting the emotional, physical, and environmental well-being of your communities. Then name, what are you going to change or transform systemically and communally? Because it is about collective care. I don't know self-care. That it was not inside of the Healing Justice framework. Absolutely not.
So just to review the definition, healing justice is a framework that identifies how we can holistically respond to and intervene on generational trauma and violence, and to bring collective practices that can impact and transform the consequences of oppression on our bodies, hearts, and minds. When we review the characteristics of healing justice, we can see that there are several components that already overlap with what we do and what we prioritize. But if we read the details, we can see how it expands our current model of health and healing. So it's a community-led response. And in healthcare, we often talk about the systems of care, right? We talk about developing a medical home. This broadens that and builds on it to include the community. And so something that might shift is our definition of what health and wellness looks like, our priorities by which we address the issues within the community. It's an emergent process to address trauma. That agrees with our current call to action. But it expands it to address the historical and intergenerational trauma. This builds on our concept of cultural competency and cultural humility, right? Because it looks at the cultural and historical roots of our practices, of our healing practices. And it also complements our practices by bringing in additional healing modalities that might be important to the community that we're serving. It also addresses the structures, which is something that expands beyond a trauma-informed model. So a healing organization and a healing justice model would address the policies and the barriers within the institutions that that trigger trauma and that perpetuate inequality and oppression. It's also a movement building strategy. And so it redefines who the healers are. Everyone is engaged in this process. Everyone is a healer. So everyone has a role to play. And so it equalizes some of those trauma-inducing power dynamics and really engages and empowers our community. So reflect on the question at hand. Imagine the circumstances that would result in collective healing, resilience, and liberation from harmful and oppressive systems. Think about what your patients require. Think about how you know that. Think about what you need. What healing modalities have worked for you? And are those available for everyone? What does your organization need to prevent burnout and the healers? What does the community need? I want you to reflect on all of these for the next 5 minutes or so. When you've come up with a list, if you want to share any of your ideas so we can review them as a group, please feel free to share them by clicking the link to the poll, or you can scan the code with your phone and it should take you to the poll. So if we look back at the ecosystem of trauma and all the different determinants that relate to toxic stress, we can see that a healing justice framework really addresses every single one of these layers. So this moves beyond just being trauma informed. This is looking at building resiliency and empowering people who have experienced ACEs, both the patient and the provider, because everyone is a healer within the healing justice framework. It's looking at the environmental and structural determinants of health, and it's building relationships and equalizing some of those toxic power dynamics.